In this podcast episode, clinical psychologist and sleep specialist Dr. Michael Breus shares his extensive knowledge from over 26 years in the field of sleep medicine. He discusses common sleep concerns, such as waking up in the middle of the night, choosing the right pillow, and the impact of chronotypes on daily activities, including sex. Dr. Breus unpacks the physiology of sleep drive and circadian rhythm, offers practical strategies for improving sleep quality, explains the dangers of untreated sleep apnea and insomnia, explores the role of supplements like melatonin and magnesium, and delves into the intriguing world of dreams. With a psychologically grounded approach, he also addresses lifestyle habits, environmental factors, and the importance of timing for optimal sleep and well-being. One of the most common complaints Dr. Breus hears is about individuals who fall asleep easily but awaken between 1 and 3 a.m. and struggle to fall back asleep. This phenomenon is closely tied to the natural fluctuations of core body temperature during the night. The body cools down initially to facilitate sleep onset, but around 1 to 3 a.m., core temperature begins to rise again as part of a natural circadian pattern. Most people briefly wake up during this time, but quickly fall back asleep. The problem arises when individuals engage in activities that increase their heart rate, such as getting up to pee or checking their phone, which disrupt sleep drive and circadian rhythm by elevating arousal and signaling wakefulness to the brain. Dr. Breus advises those awake at night to avoid unnecessary trips to the bathroom if there isn't a genuine need, and to keep their heart rate low by remaining in bed if possible. He emphasizes avoiding light exposure, especially from screens, as it suppresses melatonin production and confuses the brain into thinking it's daytime. Instead, he recommends relaxation techniques like the 4-7-8 breathing exercise, which helps reduce heart rate and calm the nervous system, promoting the return to sleep. He also suggests non-sleep deep rest methods like yoga nidra, which can partially compensate for lost sleep by lowering physiological stress without actual unconsciousness. Dr. Breus explains sleep as governed by two overlapping systems, sleep drive and sleep rhythm. Sleep drive, similar to hunger, builds up the longer you are awake due to the accumulation of adenosine in the brain, which creates a growing urge to sleep. Sleep rhythm, or the circadian rhythm, determines the biological timing for sleep onset and waking, largely regulated by hormonal signals like melatonin, cortisol, and adrenaline. He also introduces an effective real-world strategy he calls the napa latte, drinking a cold coffee quickly before a 25-minute nap. This allows the body to metabolize built-up adenosine during the nap, while the caffeine, which takes about 25 to 30 minutes to activate, blocks new adenosine from binding, providing an energy boost afterward without interfering with the nap itself. A core concept in Dr. Breus's work is chronotypes, the genetic sleep code that influences the timing of hormone release and daily alertness patterns. While most are familiar with early birds and night owls, he identifies 4 chronotypes: lions, early risers; bears, middle of the road; wolves, night owls; and dolphins, light sleepers with some anxiety. Each chronotype has a distinct peak productivity window and optimal timing for various activities like work, exercise, and even intimacy. For example, lions are most productive mid to late morning and prefer early bedtimes. Wolves flourish late at night and dislike mornings. Dolphins struggle with consistent sleep and often have restlessness or insomnia tendencies. Dr. Breus offers an online quiz at chronoquiz.com to help listeners identify their type. Understanding one's chronotype has practical implications beyond sleep timing. It can optimize the timing of coffee consumption, alcohol intake, eating, exercise, work meetings, and notably, sex. The optimal time for intimacy largely depends on hormone patterns, where cortisol, testosterone, estrogen, and adrenaline peak in the morning hours rather than late at night, making morning sex biologically favorable for greater connection and performance. Dr. Breus underscores sleep apnea as a highly prevalent but dramatically underdiagnosed condition affecting roughly 1 in 7 adults globally. It involves repeated airway blockages during sleep, causing oxygen level drops, fragmented sleep, and increased risk for cardiovascular issues and neurodegenerative diseases such as Alzheimer's. Symptoms include loud snoring, observed gasping, or apnea episodes, morning headaches, and pronounced mood changes. Many remain unaware they have it, so home sleep apnea testing, HST, is a valuable, accessible tool to assess oxygen levels and breathing patterns overnight without the complexity of hospital polysomnography. Treatment options range from the well-known CPAP machines, air compressors that keep airways open, to oral appliances that reposition the jaw, tongue vibration devices, and even emerging pharmaceutical solutions. He emphasizes that untreated sleep apnea disrupts deep, restorative sleep, including stages imperative for clearing brain toxins linked to dementia. Importantly, women often present differently than men, with more subtle symptoms and less snoring, which contributes to underdiagnosis and necessitates different evaluation approaches. Insomnia isn't just difficulty falling asleep, it includes waking too early, unrefreshing sleep, or frequent awakenings. Dr. Breus highlights the role of anxiety and fear, often related or unrelated to daytime stressors, in approximately 75% of insomnia cases. Catastrophizing around sleep loss exacerbates the problem by producing wired and tired states, where individuals try unsuccessfully to force sleep earlier than their circadian rhythm allows. Instead of attempting early bedtimes after poor sleep, consistency in wake-up time 7 days a week maintains a stable melatonin rhythm and improves sleep onset. Cognitive behavioral therapy for insomnia, CBTI, is the gold standard non-pharmaceutical intervention, teaching patients to challenge dysfunctional sleep thoughts and regulate bedtime behaviors. Although prescription sleep medications have their place, Dr. Breus cautions against over-reliance and over-prescription, urging a balanced approach that includes behavioral strategies. Alcohol, often used by people to induce sleep, ruins deep sleep stages and disrupts brain detoxification during sleep, thus worsening sleep quality despite initial sedation. The conversation covers the extensive misunderstandings and misuse of over-the-counter supplements, particularly melatonin. In the U.S., melatonin is sold as an unregulated supplement, though it is a hormone that influences sleep timing but not sleep drive. Its use is most effective for specific scenarios like jet lag, shift work, and melatonin deficiencies, typically appearing around age 50. High doses can cause vivid dreams and nightmares, and may disrupt hormonal systems, potentially affecting puberty and interacting dangerously with medications like SSRIs and birth control. The lack of quality control in melatonin products sold commercially risks inconsistent dosing and contamination. Dr. Breus advises careful use and consulting healthcare providers. Other supplements discussed include valerian root, primarily anti-anxiety, GABA, a natural inhibitory neurotransmitter, vitamin D, crucial for circadian regulation, and magnesium, which plays a role in hundreds of bodily functions related to relaxation. He advocates for single-ingredient supplements at scientifically supported doses and stresses that correcting deficiencies through blood work is often sufficient to improve sleep. A novel, natural-based remedy involves banana tea, where a banana peel steeped in boiling water boosts magnesium and phytosterol intake, potentially helping relaxation without pills. Choosing the right pillow is essential for neck alignment and deep sleep. Dr. Breus explains the importance of pillows matched to sleep position and firmness preference. For side sleepers, pillows with gussets and adjustable fill, such as shredded latex, support the neck and keep the head aligned with the sternum. Sleeping on the left side is preferable for digestive health and reducing acid reflux. Stomach sleeping is the least supportive position and can create strain and pressure on the lower back. Cooling the sleep environment is vital since core body temperature must drop to fall asleep and stay asleep. Advanced bedding systems like the Orion sleep system use temperature-controlled toppers to enhance thermal regulation. For those without such technology, practical hacks like frozen water bottles and socks can provide relief. Other sensory aspects like light, dim lighting for better melatonin production, noise, minimize disruptive sounds or use white noise, and aroma, lavender and ylang-ylang essential oils, impact sleep quality. While candles pose risks, diffusers or pillow mists can support relaxation. Sleeping naked aids thermoregulation, although pet owners should be cautious. Wearing socks to bed is situational and can help or hinder depending on body temperature needs. Dreams represent a nightly form of emotional processing or emotional metabolism. They help individuals work through daytime emotional experiences and trauma, often surfacing anxieties as nightmares or vivid dreamscapes. Dr. Breus describes dream therapy, where patients explore and sometimes rewrite dream narratives to resolve underlying anxieties, reduce nightmare recurrence, and facilitate emotional healing. Keeping a dream journal with detailed description of themes, mood, settings, and characters can empower people to better understand their subconscious. Changing the endings of nightmares through mindful revision and repetition helps stop disruptive awakenings, enabling smoother processing. He warns against relying on generic dream interpretations or AI tools disconnected from personal context, emphasizing that dreams' meanings are highly individualized and should be analyzed with personal and psychological insight. While many use alcohol to relax before bed, it impairs deep sleep, reduces REM sleep, and accelerates protein buildup in the brain linked to Alzheimer's disease. Dr. Breus recommends spacing alcohol consumption well before bedtime, consuming water alongside to hydrate, and stopping all intake 2 to 3 hours before bed to minimize negative sleep effects and hangover impact. Happy hours tailored to individual chronotypes, where alcohol metabolism is optimal, are a niche but emerging idea. Conflict management before bedtime can significantly influence sleep quality. Arguing or emotionally charged conversations late at night elevate heart rate and stress hormones, making it harder to fall asleep and negatively affecting intimacy. Dr. Breus suggests scheduling such discussions earlier in the evening or daytime when emotional regulation and cognitive function are better. Sexual intimacy itself is linked to chronotype-based hormonal fluctuations. Though culturally most couples are intimate late at night, hormones conducive to good sexual experience peak in the morning. Aligning relationship activities with biological timing can improve mood, closeness, and performance. Even coordinating work meetings by chronotype, morning for early birds, lions, and late afternoon for night owls, wolves, has been shown to improve productivity and reduce fatigue-related conflicts. Dr. Breus practices a disciplined morning routine involving sunlight exposure, breath work, hydration, exercise, and sauna use to optimize circadian health and productivity. He stresses the importance of light exposure in resetting biological clocks, recommending 15 minutes of morning sunlight. For the evening, he emphasizes creating a pre-sleep runway of activity, including preparatory hygiene, reduced screen time, dimmed lighting, and relaxation or meditation, such as guided muse headband sessions or progressive muscle relaxation. This prepares the brain for transitioning into sleep by lowering arousal. Wearable devices like the Oura Ring and Whoop provide proxies for sleep stages by monitoring heart rate, oxygen saturation, and movement. Dr. Breus recognizes their value in illustrating patterns and lifestyle impacts, particularly regarding factors like alcohol or naps, but cautions users not to overinterpret potentially inaccurate granular data due to their indirect measurement approach. Emerging technology like NextSense earbuds promises brainwave monitoring and real-time sleep stage modulation, holding promise for future sleep improvements. Dr. Breus highlights a global sleep crisis affecting over one-third of adults and the majority of teenagers, worsened by modern lifestyles, obesity, and pervasive anxiety, amplified by rapid 24/7 information flow. He stresses the need for greater sleep education and access to diagnosis and treatment, particularly for conditions like sleep apnea. His wish is a healthcare system where everyone is screened for sleep apnea, and the entire population could experience a synchronized night of restorative sleep, which might lead to profound improvements in public health, innovation, and social well-being. Jet lag is framed as a mathematical problem involving shifting the circadian rhythm through timed light exposure, melatonin use, caffeine, and controlled meal timing. Dr. Breus endorses the Time Shifter app, developed with insights from NASA and Formula One racing, to precisely schedule these interventions based on individual flight details. Using these science-based methods can substantially reduce adjustment time and suffering from jet lag, helping travelers reset their internal clocks efficiently. Besides sleep apnea and insomnia, Dr. Breus addresses the cautious use of pharmaceutical sleep aids. He supports pills when necessary, but warns against overprescription and dependence. He distinguishes between primary insomnia, not caused by other conditions, and secondary insomnia linked to underlying issues such as pain or mental health disorders. Emphasizing non-pharmacological approaches first, he integrates psychological therapies and lifestyle changes as foundational to sustainable improvement. Parents face unique sleep disruptions due to child care demands, often leading to sleep deprivation and strained relationships. Dr. Breus advocates educating children about sleep importance, establishing consistent routines, and sharing nighttime caregiving responsibilities between caregivers, on-call method to reduce burnout. He cautions against alcohol as a stress remedy in parenting and stresses planning for proper adult sleep hygiene to maintain health and relationship quality. Since sleep dehydratively affects the body, Dr. Breus advises optimizing hydration before caffeine intake, recommending at least 15 to 20 ounces of water within the first 90 minutes of waking. Delaying caffeine helps ensure that natural wake-promoting hormones like cortisol and adrenaline are fully engaged, and the stimulant effect of caffeine builds on this foundation rather than replacing it prematurely. This strategy leads to more consistent energy levels and better sleep regulation. Side sleeping, particularly on the left side, is recommended as the best position for organ function and reducing acid reflux. Back sleeping is the second best, and stomach sleeping is least favorable due to spinal strain and pressure issues. Correct pillow support aligned with body position is necessary to minimize musculoskeletal discomfort that can disrupt deep restorative sleep. Beyond pillows and temperature, Dr. Breus encourages optimizing the sleep environment by reducing light exposure in the evening, managing sound either by eliminating or reframing it psychologically, maintaining consistent room temperature, and integrating beneficial scents like lavender through safe diffusers. He warns against rigid militant sleep habits that can create friction in shared bedrooms and encourages individualized approaches accommodating partners' different preferences, such as listening to podcasts or having the TV on, using specialized pillows, earbuds, or ambient noise machines where helpful. Dreams are conceptualized as nightly emotional processing, where the brain metabolizes daytime stresses and fears. Therapeutically engaging with dreams via journals, narrative rewriting, or professional support can alleviate nightmares and improve emotional healing. Dr. Breus's work with dream therapy includes guiding patients to reimagine dream endings to replace terror with mastery and safety, reducing disruptive awakenings and promoting psychological progress. Even moderate alcohol consumption, especially close to bedtime, negatively affects deep sleep phases critical for brain detoxification and emotional regulation. Strategic timing of alcohol with hydration and cessation hours before sleep can mitigate harm, though eliminating alcohol as a nighttime sedative is strongly recommended for optimal sleep quality. This extensive discussion by Dr. Michael Breus offers scientifically grounded, practical advice tailored for a broad audience, merging clinical expertise with behavioral and psychological insights to help individuals reclaim healthy sleep and ultimately a better quality of life.